Hi, good afternoon, everyone. I'm Congresswoman Suzan DelBene. I'm so excited to be here with everyone to talk about really important legislation that we passed in Congress recently to address the healthcare costs that so many of our seniors have been facing for far too long. We know that over 58,000 Washingtonian seniors on Medicare used insulin in 2020, 58,000. On average, they spent $675 on insulin out of pocket annually. That's higher than the national average. And many seniors are on fixed incomes, as we know. They shouldn't have to choose between life-saving drugs, and insulin is absolutely a life-saving drug, and paying their bills. So the Historic Inflation Reduction Act that we passed in Congress, that I voted for, and that President Biden signed into law, will help seniors with lower costs for insulin. Starting in January of 2023, insulin costs for seniors will be capped at $35 a month. That means that insulin prices, which have been rising in recent years, those prices will no longer impact seniors because they will be capped at $35 a month. Nationally, seniors enrolled in Medicare's Part D prescription drug benefit spent $1 billion combined out of pocket on insulin in the year 2020, and more than 4 times that amount spent in 2007. So the cost keeps going up. The average out-of-pocket spending by Medicare Part D enrollees per insulin prescription was $54 in 2020. And that's over 50% more than the new $35 monthly cap. So right now, some insulin products cost as much as $116 and can be higher than that. So the cap will have a huge impact. This new historic benefit, as a result of the Inflation Reduction Act, will lower costs for Medicare beneficiaries and provide them with certainty going forward. They don't have to worry about those changes in prices because they know the $35 cap will be there. This is just one way that this new law will help our seniors afford the care that they need. Prescription drug inflation rebates start in January of 2023, so companies are incentivized to keep prices in line with inflation. Also, free vaccines for seniors, including COVID and shingles, start in January of 2023. The $2,000 annual out-of-pocket cap on overall prescription drug costs starts in January of 2024. And Medicare, finally, Medicare can negotiate prescription drug prices starting in January 2026. So many things that have been important are happening, but specifically today, we want to talk about the $35 monthly cap on insulin for seniors. And we are here at Health Point in Redmond, and we have the Health Point Pharmacy Manager, Josephine Chu, here with us. And so I'm going to turn it over to Josephine for a few remarks.
Hi, my name is Josephine, and I am the Pharmacy Manager here at Health Point Redmond. We are part of the Health Point Medical Clinic, and I just want to say thank you for coming here, and we appreciate what you do for our patients. Thank you.
Thank you. Thanks, Josephine. So we have a great panel here with us who can talk to this issue and the impact that it has on our communities. And so next I want to turn it over to Kathy McCall. Kathy is the Advocacy Director for AARP. And Kathy, let me turn over to you. You can take your mask off while you're speaking.
Great, thank you, Congresswoman DelBene, and thank you very much for this opportunity to really recognize as such a significant, momentous piece of legislation that has been passed. I don't think consumers will fully understand the ramifications of this very important bill. AARP has been working for about 2 decades on getting Medicare the ability to negotiate for prescription drugs. The VA is able to do it, but Medicare has never been able to do that. And as we have the age wave and we have the continuing number of people that are aging, where we will eventually have, by 2030, more people over 65 than under 18, we need to make sure that healthcare is available to older adults. And that means not only healthcare, and also this bill includes subsidies and extension of the subsidies. for people 50 to 65 before Medicare, but it also gives them, like the Congresswoman said, the ability to have caps on their prescription drugs and to have caps on insulin, because it's outrageous when people have to make decisions about delaying or cutting in half their medication in order to pay for food. Nobody should have to make a decision between their medication and the cost of food, or to pay an electric bill, or what have you. So AARP is thrilled, and thank you very much, Congresswoman DelBene. You have been such a strong champion. We were talking a little bit earlier about that we've been working on this for years together, and she has stood right next to us and all of our members who have been writing letters, signing petitions, making phone calls, not only across the country, but here in Washington State. We have an incredible delegation, and Representative DelBene has been one of the key champions when it comes to prescription drugs and being an advocate for older adults in this state. So, and in this region, which I also call home. So thank you very much.
Thank you, Kathy. Thank you, and we have been working on this a long time, so I agree. Next, I want to turn it over to Sam Charles. Sam's an insulin patient from Carnation, and is also from the Snow Valley Senior Center, and really can speak directly to the impact this will have on her. So Sam, let me turn it over to you.
Unfortunately, I do need to leave my mask on. I'm a double whammy. I'm not only insulin dependent since having a kidney transplant, but I had a kidney transplant a couple of years ago. So I'm glad to see ARP represented here, United Healthcare. That's wonderful. Yeah, the insulin is absolutely astronomical as far as what the prices are, even with insurance. This is such a boon, and not only the insulin, but the other pharmaceuticals as well, of which I feel like I own a pharmacy now, with all the medications. So appreciative of the work that you do. I just feel so blessed that my husband and I saved, that we have money to fall back on, and unique times like this. It does, and especially I've volunteered at the Snow Valley Senior Center in Carnation since 88, 89, and so I see a lot of us silver hairs, and it's not a poor community by any means. It's changed a lot, which is a good thing. But I see a lot of the elders there who are farmers, ranchers, who, like myself, was never involved in a union where you have a pension or anything. So everything you have at these later years, we've just busted our buns and really worked hard to save. Having this change is fantastic, because I see so many people at the center who don't have the money. They just simply don't have the money. And if it wasn't for their children and grandchildren, they wouldn't be walking among us, literally. So I just think what you do is awesome. Thank you.
Thank you, Sam.
Okay.
Thank you. I'll take you the elbows. Thank you. And it is about, this is about affordability, but it's also about people's lives.
Oh, absolutely, yes.
And so I know Dana will speak to this. I want to turn over to Dana Van Buchen. She's a diabetes patient, but she also is a clinician from Kenmore, and has worked with diabetes patients. And was my guest at the State of the Union back in 2020, which seems like a long time ago, right before the pandemic. And she was my guest so we could raise awareness around the cost of prescription drugs, particularly the cost of insulin. And so I know Dana's gonna talk a little bit also about her necklace. She gave me a similar one when she came out to Washington DC, that really speaks to why this legislation, it will be so impactful. Thank you, Dana.
Thank you. So I have copious notes to make sure I hit all of the things that I.
That's okay.
Like Representative DelBene said, I am someone who's living with type 1 diabetes. I'm obviously not yet a Medicare beneficiary, but I will be someday. I was diagnosed with type 1 diabetes just out of college. And since my diagnosis, I've taken more than 33,000 insulin injections. I've pricked my finger to test my blood glucose over 22,000 times. I don't have any fingerprints left. I've been to almost 100 diabetes-related doctor's appointments. And I started to calculate how many hours I'd been on the phone with my insurance company, but I decided I didn't want to know that number, so I stopped. I stopped that. I just want to say, first of all, that I'm incredibly grateful that there are treatments that exist for this disease, and that I've had access to amazing healthcare here in Seattle. My own providers feel like family, so I want to make sure I don't come off as ungrateful through all of this. That said, life with diabetes has not been easy. What I did not realize when I was first diagnosed was that one of the hardest things about living with diabetes would simply be affording the insulin needed to treat it. 15 years ago, the cost of my insulin was just over $100 a month. Since then, the cost of the same insulin has increased to over $600 a month before insurance. And again, I'm not a Medicare beneficiary, so these numbers may look a little bit different for me. I'm one of the lucky ones. Many people who are uninsured or underinsured or who use more insulin than I use can expect to pay more than $1,000 a month for the life-saving medication. In addition to living with diabetes myself, I work as a nurse practitioner with the diabetes research group at Benaroya at Virginia Mason. And I can tell you that for many of my own patients and for people with diabetes across our country, the cost of insulin is absolutely out of reach. I've seen patients resort to GoFundMe pages to finance their insulin. I've seen people with diabetes crossing the border into Canada or Mexico to buy insulin at 10 to 20% of the retail price here in the US. And obviously that's been something that's been harder to do in the past couple of years with border closures. I've seen people buy insulin off of Craigslist and OfferUp. I've spoken with a patient who had less than a week's worth of insulin left and no idea how she would access more. I've seen people using expired insulin. I've seen people having to choose between paying for their insulin or paying for their rent or food, like you mentioned. And I've seen people who've gotten married earlier than they had planned just so they would be able to be covered by their partner's insurance. These may seem like extreme measures to access a medication, but for the 10 million Americans that require it, insulin is not optional. As someone with type 1 diabetes, if I were to completely stop taking my medication today, I would quickly develop high blood glucose or hyperglycemia. Within a couple of days, I would develop an acute metabolic acidosis, and within a couple of weeks, this would inevitably lead to my death. In the past few years, more than 20 Americans with diabetes have died as a direct result of not being able to afford their insulin. And some of them who no longer have their own voice are represented on my necklace today. People with type 2 diabetes who can't afford their insulin may not experience such a drastic decline in health, but without the medication, they'll quickly revert to uncontrolled diabetes, which will put them at risk for complications. Poorly controlled diabetes is the #1 cause of kidney failure. It's the #1 cause of lower limb amputations, and it's the #1 cause of adult blindness in our country. It also greatly increases the risk of cardiovascular disease and nerve damage. All of these complications can be prevented with good glucose control, but this absolutely requires access to affordable insulin for those who require it. So an ounce of prevention really is worth a pound of cure in this case. A pre-pandemic study from Yale showed that 1 in 4 people with diabetes in our country regularly skip insulin doses because they can't afford to take the medication as prescribed. And as you can imagine, the financial fallout from COVID-19 has made the situation even more desperate. I tell you all of this, not so that you will despair, but so that you'll have a sense of how urgently we need insulin reform and a sense of the relief and elation that our country's seniors with diabetes are feeling right now. The insulin cap outlined in the Inflation Reduction Act will absolutely be a lifesaver for our country's Medicare beneficiaries with diabetes. It's a huge win. It is a huge win. And we are thankful to representatives like DelBene for their steadfast advocacy on our behalf. Sorry, it makes me emotional. Many of our seniors have been struggling for years with the rising cost of insulin, and now more than ever, finances are a major challenge. So anything we can do to help make insulin more affordable will improve the health and the lives of people living with diabetes. So we are absolutely celebrating the victory we have for the 3.3 million Medicare recipients who need insulin. But there's still work to be done here. The Inflation Reduction Act will not provide relief to the 7 million patients with diabetes who rely on insulin but don't qualify for Medicare. So we still do need insulin reform for all Americans who so desperately need it, not just for our seniors. And the Inflation Reduction Act, the Insulin Reduction Act is a different one, previously did include a $35 price cap on insulin that would apply to those covered under private insurance, but that was removed. The proposal received 57 votes in the Senate, but it needed 60 votes for passage. So that was a little bit of a disappointment, but it shows that we're headed in the right direction, right? We're making progress. 23 states, including our own state of Washington, have passed insulin copay caps. And Washington State's copay cap went into effect in 2021. That capped insulin at $100 a month. And Governor Jay Inslee recently signed a bill reducing that amount to $35 a month. So this is, again, a huge step in the right direction, but our state cap only applies to people with state-regulated commercial health insurance plans, state employee plans. So in other words, the cap still doesn't cover everyone who needs it. We still really need legislation to be passed at the federal level so that everyone in every state who needs insulin can access it. The doctor who discovered insulin, now 101 years ago, sold the patent for the medication for just $1. And he famously stated, "Insulin doesn't belong to me, it belongs to the world." So it's time that we honor the spirit of goodwill in which insulin was discovered. To wrap up, I say to wrap up, that doesn't mean anything usually. As a provider, I'm happy that Congress has made insulin affordability a priority. I'm celebrating over the cost protections that will be put in place for our seniors with diabetes. We absolutely still need national laws that protect access to insulin for all people living with the condition, and I'm incredibly thankful to Representative DelBene and her continued work on behalf of the diabetes community. So, thank you. Thank you so
did
much.
great. And
a lot to say.
I want to thank everyone and just highlight again what Dana said about this is a huge win for our seniors, $35 cap per month. But we need to make sure that's true for everyone who needs insulin, and so there's more work we're going to do. We have a huge win with the Inflation Reduction Act, not only with the $35 cap on insulin per month for seniors, but also the cap overall on prescription drugs that will be going into place. That will save seniors so much money and make a big difference in these terrible choices people have had to make in terms of affording food or housing or their prescription drugs. So this is a big win that we celebrate. There's more that we continue to do, and just want to thank everyone for their advocacy and work to continue to remind everyone the importance and why legislation like this is passed is because of strong voices from folks like everyone at this table who's raised awareness about how critical this is for folks across the country. Thank you so much and have a great day.